Hey everyone, how you doing? My name is Ricky Haug. I started Core Family Practice here in Kennett Square, Pennsylvania. It's about an hour west of Philly in October of 2016. So I'm about 15 months in. I'm going to be doing a video cast on getting started part two. So it's still pretty fresh in my head. It's quite an adventure starting a DPC and going through all the ups and downs of learning about how to start a business, how to promote a business. And so I'm going to, now that part one is done and you kind of went through legal setup and initial business setup, setting up bank accounts and accounting things, certainly the next most important thing would be a web presence because you want to let people know you're here and what you're doing. And with direct primary care, there's a lot of education for the community generally if it's not well known there. For example, here in Kennett Square, there's not another direct primary care in the area. We have one in Wilmington and one in Lancaster, but not directly here. So a lot of the population really didn't know much about direct primary care. So I've done a lot of just educating the community, educating some former patients of mine about direct primary care. And your website's a great way to do that, obviously. Now, I'm going to go through a few different things. There's obviously different ways you can do them and also different timelines. I mean, a lot of this stuff is done in conjunction. You're kind of setting up the business, getting your website, thinking of your logos, and doing all those things together. But I'm just trying to break it down in a stepwise place. Okay, so first, one thing you need to do in order to get your website set up is purchase a domain name. So there's lots of companies you can go through to do this. GoDaddy is really popular. There's hover.com. I use Squarespace, and I did that just because I set my website up through them, and so I was able to also purchase my domain name there. So there's a difference between a domain, the website, hosting, and I didn't really know a lot about it until I started setting this up. Hosting, you can think of as the business of providing storage space and access for your websites, kind of like a rental space to kind of host your website. So with Squarespace, I was able to do all of those in one, and so I chose that. But people have done many different things. Um, One important thing you want to do as you're coming up with your name and purchasing a domain name is you obviously want to check social media outlets, look for name availability because obviously you can't take another business with the same name, and it also may interfere with your website traffic if you're taking a really popular name and it's a completely different industry. So you want to cross check, and there's some websites, Name Checker, NAMECHECKR.com is one. And then you also want to check for name availability through state website, and you can Google that. It's different for each state. So those are important things to do just as you're thinking about the names and as you're coming up with different names. And you don't have to have your definite name when you purchase a domain. Sometimes people will get a few different ones. For example, mine is corefamilypractice.com, but I was also throwing around like Core Health or other things. And so I purchased some domains and then just let it expire when I didn't want to. You can also redirect them to the same website. So there's different ways you can do that. But part of getting set up is just thinking about what name is important to you. Some people will use their first name. Some people will use just a generic direct primary care, based on their town, like I could have done Kennett direct primary care. And then other people will choose different names. I mean, I personally was thinking of a name that'd be easy to remember, but for me, I thought about the way I got to Core Family Practice was just thinking of foundation, strength, kind of the rooting. So for my logo, I did a tree with the root system just to tie that in together. And so you want to find something that's meaningful to you, that is not already being used in your area, and might be easy for patients to remember. And you always want to Google the name you're thinking about to see what else comes up across the country, and make sure that, it's not tied to some other business or anything that you don't necessarily want to be tied to. And now to go towards the logo, that was obviously for a lot of us is going to be a totally different experience to just kind of go through that marketing branding enterprise. It's a lot to learn, but so I mean, people do it different ways. I mean, some folks will hire somebody to do the branding. Finding a local marketer. You could find people in your community that can do it. There are some websites, unsplash.com, etsy.com, 99 Designs. There's Design Crowd and Fiverr, Fiverr. So there's a lot of different ones where you could go look for things and then pay for a logo. You can find a freelancer on there who will do a logo, and you can pick from ones that are already available. You can draw your own, or have someone design it based on what you're looking for. So that's obviously really important, and that's getting the domain name, getting your logo, kind of formalizing what you want your practice to be called is all very important before you design your website, because you're going to need all of those things. So after you come up with that game plan, then the next important thing would be to actually lay out your website. Think about how you're going to do that. So again, there's lots of ways to do this. Part of it depends on your time availability. I mean, if you're somebody who is currently working for an employed position and looking to set this up on a short timeline, I mean, you might not have the time to do that. Depending on your experience level, I mean, it may take you longer to make a website than someone who has a lot of experience doing it. And cost. I mean, if you hire someone to make a website for you and host it and all of those things, that sometimes can be a much higher cost that not everyone's able to do with initial startups, because there's lots of costs with initial startups. So I personally did it through Squarespace, like I said, and I have zero website development experience, and I'm not really a techie person, so I had to spend a lot of time doing it. I was employed for 7 years, but I gave my notice and had planned on taking 2 months it felt like 2 years, 2 months to set up my practice after I had left that practice. And during the months preceding that August date, I was working on my website and learning as much as I could. But it's a lot of work, and they do make it simple with the setup, but as you want to tailor your website and make it more your own, you sometimes have to do more research into different coding and things like that to set it up. But it's very doable, certainly doable. I think a lot of the direct primary care providers have set it up yourself. I mean, we're kind of a do-it-yourself community, so I think that if you just put the time in, you can figure it out and do it. So other than Squarespace, there's also Weebly and Wix. I've known people who've used those and have been happy with those too. They do hosting and website development. And so I can tell you a little bit about how I went about, kind of deciding how to do the website. And so I first, on Squarespace, you find your template. And so I looked at various different ones and just found one that I thought had the organization I was looking for. I mean, you kind of want your website to be a little bit allow people to get a feel for who you are, and kind of what your vibe is and the practice you're trying to start up. So I looked through the templates, found one, and then I also looked at lots of other websites of other direct primary care providers across the country. I mean, people have already went through this process. Some direct primary care providers have been practicing for 5-7 years, and so they've already tweaked their sites. They've learned a lot, and most people are really happy to help share that information and use it. And so you can look at other people's websites, get ideas, and then also tell a little bit about your story in your website. And you want it to be something that gives patients a sense of who you are, why you're doing direct primary care, what that means to you, what does the doctor-patient relationship mean to you. You want to have really think about your pricing and have that displayed so that it's concise and someone can quickly look at it. I mean, people don't have a large attention span. I mean, they're checking on their phone and they may be looking through your website, and you want it to get a lot of information across in a concise way that someone gets it. They know what your price is. They know how to contact you. They know how to sign up if they want to. And if they have questions, there's answers to that. If you're looking to target businesses, you want to put some more information on the business side of things. So I spent a lot of time with that. I then, had friends and family read through my website, make edits or changes if they thought something didn't sound right or look right, and then went back and tweaked all that. And then, based on whatever platform you're using, you can have your site go live, and the website can be a powerful tool in terms of setting up wait lists. You can do mail lists from there based on like MailChimp. You can use and send out distribution lists so you can collect emails. You can set up a blog if you want to. You can, depending on which EMR you use, you can have a direct link to your EMR sign up on there. You can have a link to your EMR portal if you use a portal, and allow patients to get that. So you can really do a lot with your website. I'd say the most difficult thing I found with the whole website development was the SEO information. I mean, you put your website together, but then you have to have a way that people can find you. So if they Google you and your website doesn't come in the first 50 selections, then your website is there, but no one can find you. So I certainly found that to be difficult. I actually had left a practice that I was with, so I had patients who were trying to find me and they couldn't find me on there. I had people calling and say, I can't find your website. So I actually hired someone to help with that. I think in retrospect, I might, if I was setting this all up again, I may have Google help me do it. So one thing you want to do is when you get your website set up is you want to set up a Google for Business account. And so you can do that. You register through Google. They will need to confirm your business, but that really helps a lot for your Google presence. And you then can have the availability to do Google Ads. And I think I may have done that differently and had Google Ads, and then I think they would help set up all the SEO functions so that you're able to do that. You can research that, and there's information on how to do that, but I found that to be more challenging than actually setting up the website. Was just how can you get your website displayed there. So that's the website. So that's how I did it, was more do it yourself. But certainly I've seen people use media companies. There's dpcspot.com. There's Empowered MD. There's Dex Media, and they have different price points, and some of them are quite expensive, but you can get a really nice website out of it. They'll figure out all the SEO things for you and all of that. So it really just depends on what you're looking for. Another thing that I have done that I found helpful is setting up a corporate Gmail account. And that was another thing I was able to do through Squarespace. So then we have a generalized account for the practice that comes to me. And then I also set up a specific nurse account as well. And the benefit of doing that is you have access and control over the website. So, over the emails. So, for example, if my employee ended up leaving, I can disable that account. I can set it up for another employee and I don't lose that account. So it's not specific for a person. Like ours says nurse at corefamilypractice.com. And so if my current nurse leaves, I still have that website, and we don't have to change that. I'm sorry, the email address, and don't have to change that. And then you have access to that. You can monitor it if you need to. You can lock it if you need to. So there's different things like that. And so I'll just talk a little bit about what costs are that I have, just so you have an idea. Um, so the corporate Gmail account with the two addresses is $100, so it's $50 per address, and that's for the year. And so, but each year you do have to renew that. Um, for my domain, that costs $20 a year through Squarespace. And then the Squarespace hosting costs me $216 a year. So with all of those things, the domain name, the hosting, and the Gmail accounts, it comes out to be $28 a month, which is really reasonable. It's a lot of upfront work, to set up your website and do all that. But once it's set, it's really not that hard, and you don't have to do much to maintain it. It's there. But if you want to, if you already know how to set it up, I can just sign on to Squarespace. And if I need to make some tweaks or changes, if we're adding things or taking things away, you can always do that, edit it. So that's really nice. And then you want to just get your website out there, get cards done. There's going to be another podcast and videocast on marketing, but you really want to get your website out there. You want to get people looking at it and creating a buzz about your practice. So I think it's a really important part of growing your business. So once you get that done, and probably in conjunction with that is you want to think about, okay, now I've got my web space, now I need my office space. And so you need to think about what you're looking for with that. Again, there are tons of different models. Some people have really big offices with multiple providers. Some people have very small offices and a low volume and with no employees. So there's various ways you can do that. And part of it depends on what's available, what location you're looking at, and again, your price point. But I think it's important to start thinking about that many months before you plan on opening, because even if you're renting, it actually can take quite a while. I mean, you may have some build out stuff that needs to be done. Your bathroom may not be up to code, and that needs to be redone. There's commercial real estate is not quick in terms of getting the renting set up and all of that. So I think for me, I found it took a longer than what I was thinking it would. So you want to start thinking that, you want to start looking, you want to get an agent to take you around to kind of get an idea for what the process is going to be. And really kind of brainstorm what it is you're looking for in your practice. And I think some of the things you want to think about are, one is what are you looking for? More modern practice? Are you looking for a small down to earth practice? Are you looking for more of a formal hospital type setting, or are you looking for a more rustic house type setting? I mean, there's lots of ways you can go about going about finding a space, but it's important to think about what your vibe is and what you're looking to project when people come into your practice. You want to make sure that the space is ADA compliant. So are there ramps for wheelchair access? Are the doorways wide enough? Is your bathroom up to code? Because there are specific codes that have to be done. And some commercial spaces, if they were not prior physician offices or an older space, they may not be up to code for that. So, for example, in my space, I had to, the landlord had to make the bathroom ADA compliant. So that took a little bit more time as they were renovating and doing that. You also want to make sure that your space is approved by your local zoning board. And your commercial real estate agent can help you through that process. But you may have to go and get a permit and have them come check out the space, make sure it's appropriate. And then the other things to think about is in your space is the fit out. I mean, there's a lot of ways you can do this, and there's a lot of negotiation that can be done. But you may find a space that works great, and you don't need to do anything for it. You may find a space that works great, but you need to add sinks, or you need to build walls for different areas, and that's going to take a little bit of time, and it's also going to take a little bit of negotiation. So the longer lease you sign, usually you have a little bit more power in the negotiating the build out. If you decide that, hey, you know what, I don't know how well this practice is going to go. It's a very new idea. I'm not comfortable signing a longer term lease, so I'm going to sign a 2-year lease. Then the landlord probably isn't going to invest a lot into the build out for you, and you may have to put that money up. So that's something to think about. Location always is something to think about with real estate. If you're bringing an old practice over, the location might not be as important to you because you already have a patient base that knows you and might be following you. But if you're brand new to an area, that location may be really important. You might need the big sign out front for people to see you to generate some interest in the practice. So my particular space, I have room for another provider, and it just kind of worked out that way. I wasn't necessarily looking for that, but I was looking for a space in a particular location. I found a space that I didn't have to break any walls down or do anything. They had to redo the bathroom. I had to put a few sinks in. I had to put some cabinets in and things like that. But I didn't have to do a ton of build out for the space. So it worked out well. And I figured that with the extra office, I could sublet it out. So I have a therapist who is going to be subletting the space. So I had been, and also a nutritionist who's going to be subletting for 1 day a week. And so I had been working with some of them for a little bit, and now they're going to sublet. So that's going to help a lot with the rent, but certainly you don't have to. And I have a lab. I can show you. This is here. I have a lab space where we draw blood and have that. And then this is kind of an area where we check in. I have an extra waiting room here. Kids can play, and then I have a really large exam room. It used to be an eye doctor's office, and so the exam room is pretty large here. And so I do procedures in here and things like that. But actually, for me, I wanted a different feel for how the visit goes. So I usually see patients in my office, unless it's a sick visit. And, we just sit here and talk. And then if I need to do an exam, I'll bring them to the back for the exam. So it's actually really exciting when you can set it up the way you want. You're not joining a hospital practice where it's sterile rooms and you just lining patients up, and you can really kind of set the flow how you want and do that. But it's important to think about that before you find your space. And it also is important to remember that the space doesn't have to be perfect, because if you find it doesn't work for you, then you can start looking for a new space for when your lease is up. And if you have the opportunity to buy a building, I mean, that's always a great option too, because if you can rent out space that helps pay for your rent, I mean, that significantly decreases your overhead and can generate you passive income. So that's a great option if it's available for you. So once you get your space, you need to think about signage. Some places will already have a space, and you can work on. You just need to find a company to build the sign for you, design the sign for you. Other places don't have that, and you'd have to talk with your landlord whether you're able to put that in. And then when your space is obtained, then you have to think about setting up your Wi-Fi, your phone system, what you want to use. There's lots of different options. I use Verizon Business Digital Voice. It's worked great. Other people use Ring Central. I mean, you can find lots of different ways to do that. And then furnishing, so finding your equipment. I I actually got a lot of stuff used from an old office. So you can look on Craigslist. You can search different if you know any providers who are moving, get their stuff. It's really expensive to buy exam tables new, and so that's a great thing to look for used. And you can find lots of different. You can get really creative in terms of furnishing your place. Um, then what you want to do is set up with Quest and LabCorp, or a local lab, and they'll provide. So I have a Quest centrifuge in there in that lab that I showed you, and they'll get you all the supplies. So you can just contact with them, and then you want to negotiate pricing with them. I think there's going to be another video cast on price negotiation, but that's all really important too. And then other things you want to think about once you have your website set up, your business entity set up, your space, and you're getting ready to roll, and you found your EMR, and you're close to getting your patients. Some of the other big things that you need to make sure you've had, and these are things you probably would take care of when you're setting up your business entity, but opting out of Medicare, malpractice insurance. And for the malpractice insurance, there's actually really great options for lower volume practices where you can pay a smaller premium. I use the Cunningham group, and I think a lot of direct primary care docs do. And if your volume is lower, then usually you get a better rate for that. And then there's a whole host of information on opting out from Medicare on DPC Frontier. So I would definitely look into that. And you do actually want to do that early on because you can only opt out quarterly, I think. So you'd have to look into that, determine when you have to get your opt out in, if that's something that you're choosing to do. But DPC Frontier has lots of information on that. And so I would definitely look through that website before you get your setup done. And I guess that's about it for this second part of practice setup. I'm always happy to answer questions, so you can always contact me, core@corefamilypractice.com, and I'd be happy to talk. Feel free to call, and we can talk through things more. But anyway, hopefully this helped, and good luck setting up your practice.